Hello again, everyone. Welcome to Fayette Regional Health Talk. I'm Tammy Dowd.
And I'm Doug Fischesser. Thank you for joining us. As always, Health Talk is made possible by TV3 and Fayette Regional Health System, so viewers in the Whitewater Valley can be better informed of the health and wellness topics and opportunities in your area.
That's right, Doug. And Fayette Regional Health Talk is also your source for up-to-date health news and events that are important to Connersville, Fayette County, and the entire Whitewater Valley. Leading this edition of Health Talk News is a reminder that Fayette Regional Health System has extended hours for your immediate care needs at their Fayette Regional Primary Care Center. Fayette Regional Primary Care Center has a full staff of care providers with Dr. Ryan Minnick, Dr. Gary Metcalf, and Dr. Jessica Douillard, along with 5 nurse practitioners. They can take care of all of your immediate care needs 7 days a week.
Walk-ins are welcome Monday through Friday, and even on weekends for adults, seniors, and kids too.
Fayette Regional and ClaimAid would like to help the community better understand the recently approved Indiana Medicaid Expansion Program, Healthy Indiana Plan HIP 2.0. HIP 2.0 is an affordable health insurance program from the state of Indiana for uninsured adult Hoosiers. The Healthy Indiana Plan pays for medical expenses and provides incentives for members to be more health conscious. HIP 2.0 provides coverage for qualified, low-income Hoosiers ages 19 to 64 who are interested in participating in a low-cost, consumer-driven health care program. It's a great plan for people to work with their doctor for more cost-effective and preventative care.
Choosing a health care provider, determining monthly premiums, and understanding health insurance plans may be difficult for individuals and families who have never had health care insurance. Fayette Regional and ClaimAid can help give you the overview of HIP 2.0, outline who is eligible to apply, and explain how to utilize the program. If eligible, ClaimAid has certified navigators available to guide you through the entire enrollment process.
If viewers have questions or like to enroll, please contact Tricia Blevins at Fayette Regional by calling 765-827-8998. As part of Fayette Regional's continuing efforts in community outreach, we are providing a monthly screening and activities as well as participating or hosting several events in and around the Fayette County.
The first Wednesday of the month, Fayette Regional will be at Fountain Place Apartments in Connersville to provide education and activities beginning at 2 p.m. To round out the week 1 of each month, Fayette Regional Care Pavilion and Jerry Psych Services hosts a Caregivers Relaxation Luncheon the first Friday of each month. Caring for persons with chronic illness is a rewarding endeavor, but often places extreme demands on the caregiver, who can sometimes become overwhelmed trying to balance work, family, and caregiving demands. This can result in the neglect of their well-being. We are pleased to offer this Caregivers Relaxation Luncheon as a time of respite for caregivers to refresh mind, body, and spirit and learn ways of taking care of themselves.
The first Tuesday of each month, Southview Courts in Liberty, Indiana hosts Fayette Regional. Blood pressure and blood sugar screenings are provided along with education and activities.
Call 765-827-8022 for more information or to make your reservation.
And continuing on the second Tuesday of each month, Fayette Regional offers a free lunch and learn to seniors of Fayette County Senior Center at the Fayette County Senior Center. This month's event is always well attended and free health screenings are offered. Our presentation begins at 11 and lunch will be served at 11:30. If you wish to attend, please make your reservation by calling the Fayette County Senior Center. Fayette Regional is also at the Franklin County Senior Center at 9 a.m. the second Tuesday of each month, again providing education, activities, and health screenings.
Fayette Regional staff and the community alike raise their sleeves throughout the year to give the gift of life. Last year, over 60 units of blood were donated, helping supply over 60 hospitals in Indiana. Please join us by supporting these blood drives. Go to FayetteRegional.org for a full listing of blood drive dates. We look forward to seeing you at these events. When we return, our guests will be in studio to tell about a very serious issue many of our youth have to deal with. We'll be right back.
Can't afford health insurance? Fayette Regional can help. The Healthy Indiana Plan, HIP, has been expanded, and now many more Hoosiers qualify. There are inexpensive plans that include medical, dental, and vision care. Fayette Regional has the resources and staff that can help you sign up. Call 765-827-8998 or visit FayetteRegional.org for more info. Fayette Regional, your community hospital.
Walk-ins are welcome at Fayette Regional Primary Care Center. Open 7 days a week for when children, adults, and seniors need to see a doctor. Open until 9 p.m. Monday through Thursday, till 6 on Friday and 9 to 3 on weekends, with both doctors and nurse practitioners on staff. No appointment necessary. Located right in Connorsville, just 1 block from the hospital, the Fayette Regional Primary Care Center.
Welcome back. Joining us is Katrina Norris from Fayette Regional Care Pavilion. Thanks for joining us today, Katrina.
Thanks for having me, Tammy.
Katrina is the director of Fayette Regional Care Pavilion. She is here to help us all better understand the issue of youth suicide. We appreciate you joining us today. Can you start by telling us a little bit about yourself?
Well, I'm the director of Fayette Regional Care Pavilion. I am a licensed clinical social worker as well as a licensed addictions counselor. I have been with the Care Pavilion working on 8 years now and done about every job in the building from the inpatient to the outpatient side, clinical supervision, and of course administration now.
Great.
Well, this is a real serious topic that we're discussing today. How big of an issue and how common is youth teen suicide?
It's very prevalent, unfortunately, and I think that's something that brought this to light. We really need to talk about this. It's the 3rd leading cause of death amongst people ages 10 to 24, and that's approximately 4,600 people a year taking their own lives. So I think it's a very prevalent, serious issue.
So when we are looking at suicide in our youth, what methods, I guess, are the most common, or did we need to really address most, I guess?
Most youth suicides occur at the hands of firearms. 45% of all suicide youths are with firearms. Then there are other methods, obviously, that are on that list of most commonly used. Suffocation being one, poisoning, which usually comes from an overdose, is another one.
Okay.
What trends have you seen over the past few years with youth and suicide attempts and things like that?
Well, Doug, times are changing, obviously, and technology has brought increasing social stressors for youth. And all of our kids tweet and Facebook post and Instagram everything in their lives. So we've seen technology play a huge role in social stressors for youth, because what also comes with that is that they don't know how to manage the outcome, the outcome of their actions. As youth, we don't always make the best choices. And it's a time in our life where we're trying to figure out our identity and who we are and build relationships. And so this technology piece has really changed the way that they do things, the way that they communicate. And I've seen a huge increase on my unit of youth that send a picture or send a text that maybe they regret after the fact, and it gets forwarded around, and then everybody in school has seen it. And so when you come back to school the next day and all of these people are calling you names or picking on you or teasing you, they just don't know how to cope with that kind of stress, because the intention was never for it to be spread around. It was supposed to be to one person they cared about. And so when they get overwhelmed at that point in their life, they're not really thinking logically or rationally about how to handle that. So that's one trend we've seen. A lot more females are making attempts. Males usually are successful in their attempts, whereas females make more attempts that are unsuccessful. We're thankful they're unsuccessful, but the girls tend to report more than the males. So we've seen those changes. Probably the scariest change I've seen is 16% of all high school students report they have seriously considered suicide. That is a frightening statistic. for our youth today.
That is. Tell us a little bit more about the effects these attempts have on families, their relatives, their friends.
Well, the families tend to have extreme reactions, and I think that goes without saying. That's normal. If your child attempts to hurt themselves, as a parent, that is very difficult to deal with. So we see extreme reactions from parents. We see parents who don't have a lot of knowledge or education about the warning signs of suicide. They don't think it can happen to them. And so when it does, it's very shocking. It's very traumatic. And if you can try to imagine what that would feel like as a parent, and you start beating yourself up, and what did I do wrong, and how did I miss this? And of course, hindsight's always 20/20. So we want to make sure that families know those warning signs. We want to make sure that they're not feeling stigmatized, like something's wrong with them. And we obviously don't ever want the victim to be blamed. So it really does vastly affect the families.
Right. So what are we looking at as far as for our youth, are the risk factors? What other outside stressors and risk factors are you seeing?
Well, there are some significant risk factors and warning signs, and the most prevalent being a history of previous attempts. If they have attempted once, it increases their likelihood to attempt a suicide again. Also, if someone in the family has committed suicide, it becomes, well, my uncle did this and it was his way out, and it changed the dynamics of the family, so that increases the risk as well. And then, of course, untreated depression is a great indicator that a suicide attempt could come because of the hopelessness and the feelings of helplessness and hopelessness and depression. Depression is a chronic illness untreated that can lead to obviously worse scenarios. Stressful times that youth are going through, perhaps a divorce, a parental incarceration, a death of a close family member, those are very stressful times. And for high achieving youth, stressful times also include things like SATs or not being accepted to the college that they had applied to. That's a devastating blow to someone who has set their whole life with this one university, and I'm going to graduate and I'm going to attend this university, and then they get a denial letter. That is an extremely stressful time. Substance abuse is a high indicator for a suicide attempt, whether intentional or unintentional. That's how overdoses occur. And sometimes that's the easiest way out, unfortunately. Access to lethal methods. Most of us that have firearms in our homes secure those. And in this day and age, I think that has to be the key to preventing this. Is this community, we love to hunt, we love to fish, and we love the Second Amendment, but we have to secure those firearms so that we make it more difficult for youth to get those.
Not quite so accessible for them.
Exactly.
So, okay, we just kind of discussed one protective factor, but as a parent, what can I do to help protect my child? But then also education, looking at how can we educate our children on the dangers of social media, and looking at more preventative measures versus waiting until
something bad happens.
To take action, right?
Obviously, involvement in the community. If they are active in the community, if they participate in extracurricular activities, if they have positive support systems, people they can go to and reach out to when they're feeling depressed or when they're having these thoughts. And as a parent, knowing those warning signs. Religious factors are great for protecting youths and protecting families, because you have an added support system built in with your youth program or at your church, and that process becomes the norm. And the more support people have, especially kids, the less likely they are to commit suicide.
I see. Katrina, what are some of the community resources that exist out there for youths that have made suicide attempts or are thinking about suicide?
Fayette Regional Care Pavilion we specialize in crisis. We have an acute stabilization unit for youth 6 to 17, in which if they are having suicidal thoughts or they have made an attempt, we give them an intensive treatment. It is a short-term stabilization program where we really focus on medication management to address the depression, to address the anxiety, but more importantly, in my opinion, they get an extensive amount of therapy as well. And we really start to peel back those layers to what led to this situation of crisis. And it is a true crisis unit. We don't just treat that patient, we also treat the family. And we do family sessions within 48 hours of admission. And that way we can give the parents those resources, education, tips, things like that, to help them, because they're going to have an extreme reaction. And it is a scary time for them, and they need as much support as that youth does. So.
And so it would be the extended family perhaps as well, so parents, then siblings. I mean, how much family therapy, how many family members, I guess, are involved in the therapy?
Generally, we focus on the primary caregiver, whether that be parents, grandparents, foster parents sometimes, because that is who the youth's going to go home with.
Okay.
And then if they need additional support, we're more than happy to bring those siblings in to help them cope. We set them up with outpatient therapy. We have a full outpatient clinic that serves all ages at the Care Pavilion. And also there's community mental health in Fayette and surrounding counties, whether it be Meridian or Centerstone. There's a program called Communities in Schools, in which they are counselors at the school, and I think that's a great safety net and resource. And then we also always provide families with the National Suicide Hotline number, which is 1-800-273-8255. And that way, that's 24 hours a day. They can call and talk to someone and get the help that they need.
Good. Okay, so Katrina, again, we've established that the statistics are frightening. We know it's happening. Let's just take a case study, a scenario. I get a text, or my daughter gets a text, someone gets a text that says, I'm thinking of killing myself. What do we do? What is the proper procedure at that point?
Well, I think first and foremost, you take it seriously. So many people blow things off, and we're talking about human life. You have to take it serious. You have to treat every text, every tweet, every Facebook post that says I'm thinking about killing myself serious. They will do it, and all of the research and all the statistics show that people who commit suicide generally have called out for help. They've written a letter, they've posted something to social media, they've attempted to calls to their family, they've left voicemails, they've given away their prized possessions. So there are some significant signs that this is a serious statement. And what I would suggest is you immediately respond to it. Call that person back, notify authorities, notify the guardian if they're a child. And law enforcement is trained to respond to crisis situations such as a suicide attempt. If someone is locked in their house saying, I'm going to kill myself, they will enter that home. If it's a youth, obviously the parents need to know that this statement has been made so that they can seek treatment for their child and get them secured and safe. And that always has to be the priority, is maintaining safety.
So you can never assume that it's just they're wanting attention, which I've heard before, or they've said that before, nothing's happened. You have to take every single threat as a serious possibility of an attempt.
Absolutely. Because if you chalk it up to attention seeking, you can lose a loved one. And I think talking with that person and seeing where they're at and knowing that there are resources available in our community for adults, children, and older adults even, that we have to respond to it and make those referrals and know that these resources exist for our community.
Wow, again, great information. Great work at the Care Pavilion, and we appreciate you coming in today, Katrina. Thank you.
Thanks,
you,
Doug.
Katrina.
Fayette Regional Mental Health Minute.
We often underestimate how important maintaining balance in mind, body, spirit, and community contributes to living life successfully. All of us experience times in our lives when the scales of life become out of balance. You may feel overwhelmed and believe there is nothing you can do to realize a life in balance. Most of the time we can rebalance our life scale by addressing the issue at hand. The need for mental health treatment comes when the scale is tilted to a degree that cannot be corrected without a healthcare professional. With a thorough evaluation, we will find out where the shift is occurring and identify treatment options to return balance in the least restrictive environment. For more information on achieving life in balance, call Fayette Regional Care Pavilion at 765-827-8022. There is help, there is hope.
Welcome back. It's time to shift gears and discuss a topic that typically involves our aging adults. I'd like to welcome our special guest from one of our community partners, Joni Howell, Executive Director from Lincoln Centers for Rehabilitation and Healthcare.
Hello.
Hi, Joni. Welcome.
Thank you for having me.
Well, we're glad that you stopped by. You've been in the community for about 2 years now, and I know many people do know you and know what you do at Lincoln Center, but can you give us a little bit about your background, what you do at Lincoln Centers?
I can. I'm the executive director at the facility, and that means I am responsible for any and everything that happens in the building. I'm the first person that everyone talks to and the last that they talk to possibly as well. We are a 166-bed skilled facility. It includes independent living as well, so we have independent apartments in between the nursing homes as well. So I've been an executive director for almost 6 years, and I really enjoy what I do.
Great. Well, it's good to have you, Joni. Tell us a little bit about the services over at Lincoln Center.
We offer a wide variety of services. We start out with your private transitional care suites. We also have private short-term rehab to home programs. We have private memory care suites, early stage and late stage memory care, long-term care services, respite care, hospice services, and then our independent living apartments as well.
Great. Now, do most insurances cover these services?
We do. We actually accept all types of reimbursement. There's Medicare, Medicaid, we have commercial insurance, managed care, private, and self-support.
Okay. So you touched on your memory care unit, and I know that that's a large part of what you do. You have one of the largest dementia care units in our area. So can you give us a little bit more detail about that? And you talked about the levels of care. Give us some more details on that.
We have 3 locked units on our facility in our east building. One of the locked facilities and one of the locked hallways is a 13-bed unit. We have all of those patients are either able to walk independently or with little or no assistance. Those residents are ones that might need to be reminded to shower and groom daily. They also may be patients who need to be reminded of eating 3 meals a day and taking their medications. That's one of our highest functioning units.
Okay.
The next unit that we have is our step-down unit to that, and those are the patients with Alzheimer's dementia or behaviors that may have a little more harder time physical mobility-wise. They may be wheelchair-bound, need walkers, wheelchairs. Some of them may need canes, some of them may be wheelchair bound, but those patients are in that unit. And then the next unit that we have are our patients who have a different type of needs. They may be patients who are inappropriate sexually, they may also be inappropriate, they may yell a lot, they may not have self-awareness, they may wander into other people's rooms, they may also get very close to you and have personal space issues. And there's 14 beds for that unit.
Okay. And you mentioned that these are all locked units. That's kind of a scary word maybe to someone that has not had the experience of having a loved one on a dementia. Why is a locked unit different from any place else in the facility, and why is it being locked? Why is that important?
A locked unit helps to keep the patient safe and for safety awareness. For example, we have some patients that have been out in the community and maybe have gotten out of their home and wandered and not been able to get back to their home safely. So a locked unit keeps them secure for all the weather, types of different weathers. Indiana winters can be brutal for the elderly if they get outside. Frostbite can take effect and people can pass very quickly with that. So the locked unit's for security purposes.
And a lot of the patients with dementia, that's part of it. They wonder and yeah. Okay, all right. I know you always have something exciting going on. What are some of the upcoming events that are going on?
One of our favorite times of the year is up next week. It is National Nursing Home Week.
Okay.
And we start the celebration off on Sunday for Mother's Day. We do our Mother's Day ice cream social. And that's a really fun event for all the women in the facility. And then for the rest of the week, the staff and the residents celebrate. Monday, we have Western Day. That means everyone will be in their cowboy get-up all day long. We'll eat things that are Western, like barbecue. Tuesday is our Bingo Bash Day. Per resident request, we are playing bingo all day long.
It's a big deal to our older adults, for sure.
It is. Wednesday, we're going to do a safari day. We have a company that's coming in and bringing in wild animals. We're supposed to have a leopard there on Wednesday for the residents to check out and staff. Thursday, we have our cookout day and game day. We're hoping for good weather, and we will be outside playing ring toss, horseshoe, those kind of things. And Friday is the final day of our National Nursing Home Week, and we are having a senior prom this year.
Very exciting.
So we are going to get all of the ladies and gentlemen dolled up and dressed, and we're going to be having a DJ and a prom on Friday night. We're super excited about it this year.
We'll look forward to seeing some pictures of that. That'll be fun.
Kind of goes along with the prom tomorrow with out at CHS.
Yes, it does.
Well, great.
Good timing.
Well, Joni, thanks for joining us today, and be sure to tell all your friends to check you out on TV because that career is going to skyrocket. I'm telling you. So.
Thank you.
But we definitely appreciate you being here with us today. Thank you.
Thank you for having me.
Thanks, Joni. We'll be right back.
Fayette Regional is proud to welcome Dr. Amy Wynn to our Healthy Women OBGYN staff of physicians. Joining Dr. John Landry, she will be providing outstanding OBGYN services to the women of Fayette County and the Whitewater Valley. Visit their offices at 3542 Western Avenue or give them a call at 765-825-0538 to set up an appointment. Great care is right here at Fayette Regional.
Welcome back. That's all the time we have for this episode. We look forward to everyone joining us again next time on Fayette Regional's Health Talk. I'm Tammy Dowd.
And I'm Doug Fischesser. Stay healthy, Connersville.